All right, great. Well, hello everyone, and thank you so much for joining us tonight. And thank you, Dr. Eric Alcouloumre, for joining us for this chat. Now, Doctor, I was wondering if we could start with you introducing yourself and your relationship with the hospital that you work at and the coronavirus pandemic.
Okay, that part should be easy. Introduce myself. I'm Eric Alcouloumre. I am an emergency physician. I've been doing this for a long time. I did my undergraduate and my medical school at the University of Oklahoma, but then did my internship and residency at USC. I was actually on the faculty there for a few years before I moved down here to Orange County, where I've been working at Hoag Hospital, spelled H-O-A-G, in Newport Beach, which is a really, really good hospital. I've been very lucky to have landed there, and I've worked there for about 34 years, I think. As I told a few of you when you first were getting on, I had a dental filling done today, and half of my mouth is still numb, so I smile funny, and it's funny when I talk, so if I'm mumbling, let me know, and I'll try and fix that. In terms of my relationship to the coronavirus, fortunately, in California, we have not seen a ton of it yet, like they're seeing in other places like Italy and New York and places you've heard about in the news, but we are seeing it. The reason we're not seeing a lot of it right now is because of the efforts of the community in California, primarily because Governor Newsom laid down that stay-at-home order, which I'm sure you guys are very excited about having to follow, but it has made a huge difference, a very, very real difference, because we were expecting to have to deal with the surge of thousands and thousands of sick people, and hospitals are just not prepared to take care of that kind of patient load. So I'm very thankful. I guess a few of you know that I somehow stumbled into starting a Facebook blog about 3 weeks ago, where I've been trying to just encourage the community not to go out in public and to socially distance and take care to wash their hands. And so that's kind of the short version of my relationship with the coronavirus. But I worked a shift last night, didn't have any patients with coronavirus, but did have several that had symptoms suspicious that we had to test. And we have had several in our hospital. We've had a few deaths. So it's a bad disease if it gets you and you get the bad version of it.
Great, thank you so much. Now, Doctor, you manage the emergency room at your hospital, correct?
Yeah, I'm one of the guys. I'm not the number one guy. I'm the number two guy, and have been for a long time. But yeah, I help run the department.
So, how much time did you have to prepare before it actually hit your area and your hospital, and how successful were those preparations?
Okay, that's a great question. And the warnings came out in the very first part of January, and we have actually two hospitals in Orange County, the one at Newport Beach that I work at, and another one in Irvine. We had one of the first, I think, 5 cases in the country at our hospital in Irvine about the 20th or so of January, and it was a person who was returning from Wuhan, China. And it was just as we were all starting to hear all of the crazy news about what was going on over there. And at that time, we'd already begun preparations. We've had to go through this before. Most of you are too young probably to remember a lot about this stuff, but we had a similar coronavirus called SARS back in the early 2000s. And then we also had a scare with Ebola, which was in just the last few years. We had to isolate the patients who came in with symptoms of the disease based on their travel history and the symptoms they had, and then be prepared to put in all the personal protective equipment and to isolate them so that the risk of spread to others, not just in the hospital but in the community, was minimized. One of my partners who works at Irvine, our Irvine hospital, smart guy, went in and out of the room several times, always doing the PPE. And one time he went in, he forgot to put his goggles on. And that was our first case. And all of the infection prevention people, when they found out about that, went crazy. And he had to go into quarantine for 2 full weeks. He had a baby at home and a wife who was pregnant with their second child. And what he described was just crazy. He said, like, the CDC people showed up at his front door, and they have, in front of his neighbors, they were all dressed in the full protective gear. And it was like he was just a total outcast in his own community. He was so terrified. And he never had any symptoms. He did fine. But as we've learned more about the disease and as it got out of control and more widespread, we don't have to do that anymore, exposed to somebody and then lock ourselves up, completely for 2 weeks. We're still taking care of patients. We just have to be monitored. But that was our first case back in January. And we were prepared, but again, the numbers we were dealing with then were tiny. It's one patient. And we didn't start seeing more patients really until they began trickling in over the next couple months. Our hospital has gone to extraordinary lengths to be prepared, as has every hospital in the community, in terms of acquiring protective gear. As you've heard, especially on the East Coast, where they've had so many overwhelming numbers of patients, they're running out of gear and ventilators and space to treat patients. They just don't have the capacity to do that. And if we get a chance, I can probably share my screen and show you a couple of things that kind of explain how that happens. But I'm on the board of directors of my hospital as well, so I get a lot of inside information. And I'm very confident that our hospital has the back of the employees that work there in terms of adequate equipment, and we're not likely to run out, especially given that our curve in California has remained so flat and our patient volumes aren't going to stress the system to the same degree that it's happening elsewhere.
Right. Wow. And so how are other emergency room visits, that are non-COVID related being treated? Has there been a change in the amount of visits of this nature?
I'm sorry, the last part you broke up a little bit.
So how are, other emergency room visits that are not related to COVID being treated? And has there been a change in the amount of visits of that nature that are not COVID related?
Absolutely. It's another great question. So my particular hospital, we usually have between our doctors and PAs about 12 providers over the 24-hour period to see the patients that come in. And we average 220 to 250 patients a day, normally around this time of year. Our average right now is about 100 patients a day. So it's plummeted down. There's not enough work for us to do when we're there. I mean, you see all the horrible things going on the East Coast, which we were literally terrified of having to do because of the stress on the system. We're not feeling that at all, and it's just the opposite. We are worried that people who are sick are afraid to come to the hospital because they think we're going to give them the virus, which is not the case. The way we handle things up front, before you even get through the front door, there are people out there who are triaging and separating out people with any type of respiratory illness from everybody else. So we're still there taking care of people with strokes and heart attacks and broken legs and lacerations and all the usual things you would take care of in an emergency department. But those patients are segregated away from any patient who might potentially have an infectious upper respiratory infection or pneumonia or any symptoms that could turn out to be COVID once the testing is done. So we're still doing what we're supposed to do. This just presents an extra challenge for us.
Oh, that's great. Thank you. And this next question comes from one of our members, Thomas Kim, and he asks, experts, politicians, and the general public talk about flattening the curve. How long would the curve have to be flattened to really be effective? What happens after the curve is definitively flattened?
Okay, that's a very good question. I'll give you a very honest answer, and that is I don't know, but I'm going to try and show you why. So give me a second. I'm going to pull up. Do you guys know about IHME? University of Washington Statistics group here. So give me just a second, and I'll pull that up and see if I can share my screen, if that works. So 1 second, share the screen. Oh, you disabled it, Jimmy J.
Oh.
Can you make me less disabled here for just
Jimmy J.
I apologize. Okay. I'm going to make you would making him a co-host help you guys know? Um,
Okay, I feel so special. Let's try that again. Okay, it looks like it's going to work this time. Okay. All right. So this is kind of a fun website to play with, and it's pretty informative. Are you guys able to see it?
Yes.
Great. Okay.
Yeah.
So the IHME is, oh, I should remember what the letters stand for. Give me 1 second. It's the Institute for Health. There are a bunch of big words. Where is it about IHME? Institute for Health Metrics and Evaluation. And these guys are one of the groups that does a lot of the projections that you hear about in the curve. So here's the curve for the United States. And as you can see up here, it says that these are projections assuming full social distancing through the end of May, okay? And what you see here is this purple line here is the number of beds that they expect will be needed, okay? It's easier to do it by states. I'm going to take you to California. Let's just go to California because this big blob on top. But you can see the difference between what the United States looks like and what California looks like in terms of how high this curve is. So the solid purple area is all of the beds that we have available in the state of California. The dotted purple line is the beds that they expect will be needed to handle the COVID patients. Oh no, I'm sorry. This solid purple line up here, here it is. This purple line is the number of beds available. So we have about 27,000 beds in the state of California. In fact, 26,654 to be exact. And then this purple line here is how many beds they project we need. The big gap between this dotted line and this solid line, okay? This green line here is the number of ICU beds available, and the number of beds we need is so low you can't really even see it. This dotted blue line is the number of ventilators we need, which is about the same as the number of ICU beds, because almost everybody going to an intensive care unit needs a ventilator to help them breathe, and we can talk about those details later. But what you can see is because our dotted line is down here of what we need, and the solid line is way up here, we're well within our resources. And up here it kind of summarizes, it says 0 bed shortage and 0 ICU bed shortage. You compare this to New York, and you'll immediately see the difference and why I'm at home relaxing right now and not having to live in the hospital. So look at the difference. Here's their purple line of how many beds they have. And this is a purple line of how many, okay? So you see the difference, and it gets even more dramatic with the ICU beds, which is a much more critical resource. The green solid line near the bottom, that's the number of ICU beds available. And then this dotted blue line, and you can't really see it well, but the dotted green lines behind it shows how many ICU beds they need. So they far exceeded their capacity. And the numbers are right here, just 3,482 beds short and 4,854 ICU beds short as well. They just it's that critical. So you see all of these things on the news where all these doctors are running around in very crowded, cramped spaces with patients with a highly infectious disease next to each other. It's a very, very dangerous thing to do, and they just exceeded their resources. And because we were able to start social distancing much earlier on this curve than they did, and there are other factors why New York is worse than Southern California for this kind of disease, but we seem to have mitigated that horrible thing. Well, if you do go to the website, you'll see as you move the line from left to right, you can see what the need was on given days, and that kind of tells you a little bit about how the thing unfolded. Then you can see now the slope of the curve going down. So I know it's a very long-winded way getting to try to answer the question, but this gives you a sense of how this is going to go in terms of the peak need. Even though New York hit their peak on April 8th, and the number of new cases is starting to go down, they're still above their capacity for quite a while, especially on ICU beds. So that's going to be a bit of a problem. Our peak was supposed to be today, but I noticed earlier when I peeked at this, I looked at this, that they revised it. They revise this every 3 days. Now they think it's going to be 4 days from now. So you can kind of see what happens. So this is April 4th, and things have been kind of flat in terms of the projected need with the number of patients who are sick. And then I worked last night, which was April 12th, and today is supposed to be the peak. It looks like it's going to be a little bit of a tiny bump in a few days, but we're still so far within our capacity to take care of it. So when does this go away, or when do we no longer need to, and I forgot what the question was exactly, how long till the peak, till we come down from peak and get back to normal? Nobody really knows. And the problem is because we still don't have adequate testing. And that's a whole long, crazy, complicated subject. The best way this could have been managed is back in January when we first started hearing about this case, that the government had mobilized its resources and made widespread testing available. So before we had millions of people with it and millions of people with it, we could find those people, we could isolate them, we could start working on a vaccine, which is going to take 1.5 years anyway, but we wouldn't have those people with this highly contagious virus spreading it to everybody else. There would have been some degree of social distancing, but it could have been more controlled. But we blew that opportunity.
No.
And I guess I'll just finish this last part real quick, and we can come back to it later. So to get back to normal, we need to do testing, but it's no longer as important to find out who has it, because almost everybody has been exposed, but it's to see who actually has antibodies, who's been exposed to it, has hopefully developed immunity to it, so that those people can start to go back in a controlled way. Most of them being protected, but everybody still needing to be monitored in some way. And then as new cases come up, you can try and do the isolation and mitigation. I'm not an expert at that stuff. I'm telling you what I know from what I've read, but it's not my area of expertise. So I don't want to mislead you into thinking I'm, an infectious disease or public health genius, because I'm not. But that is what's going to have to happen. It's going to have to be very organized. It's going to have to be gradual. It's not going to be a flipping of a switch where we can say, okay, everybody, let's go back and do all the things we were doing 3 months ago, because then we run the risk of having the whole thing peak again just as bad in 3 or 4 months.
Right. And President Trump has suggested that he considering opening, the economy or parts of the economy next month. Do you think that is a viable choice for the country to make?
I don't think it's realistic. And I understand the pressure that he's under. I mean, I think the smartest thing I've heard him say about all this is that this is the biggest decision he has ever had to make. And I think he's absolutely right, because literally it's, for some people, thousands to hundreds of thousands to perhaps even millions. It's an issue of life and death. And he doesn't want people to believe this. And there's a lot about this in the news yesterday and today. But the decisions that he made in January and February and March have already literally cost people in this country their lives. My personal feeling is that was a failure of leadership, but we need leadership now. He needs to make a hard decision. He needs to listen to his advisors. I don't want to minimize the horrible effect on the economy that this has had, how important that is to all of us. You guys, more than anybody else, know how it's affected school. I'm a little bit older than you. It affects my retirement plans. It affects all sorts of things that I would have loved to have done. My wife and I were supposed to go on a trip to Europe at the end of May. Well, that's not happening. Stuff like that. That's very, very much on the insignificant side. For other people, are they going to be able to eat, buy food? How much support are they going to get from the government for that? So President Trump has a lot of pressure to try and get the economy up and running. But if he gets the economy up and running and the price we pay is having to go through this again in July or August because we didn't link the economic recovery to protecting the country from a recipient disease, going through that graduated testing for people with antibodies to see who's immune, and then testing for the disease itself, which is the thing they ram up your nose, which I've had it done. It's no fun. But to see if you actually have the disease, and then target those people, isolate them, and protect the vulnerable. You know, the effect on the economy will be just as bad in 3 or 4 months as it was this month if you have to pull everybody out of work again because people are dying.
Right. All right. Thank you so much. This next question comes from Mia Spire, another one of our members. And she asks, assuming that people can get the disease twice, then wouldn't any attempt at returning to normalcy and reopen everything cause another wave of the pandemic that is just as bad as it is now?
Yeah, that's obviously a very scary thought. And I've seen some things suggested, and it's all pretty anecdotal. It's not widespread and not proven, but that there are isolated cases where somebody had it and had it again. I've also know of some cases where people have it, they feel like they're better, they go get tested again, and their test is still positive after a couple weeks. So there is some of that, but that doesn't seem to be the norm. We still don't know enough because we haven't done all the testing. We were very, very late to the game to getting the test available. So this is the kind of information and data we need to know before we can actually make predictions and recommendations about what to do. I don't think that recurrence of disease is going to be, like people getting it multiple times, is going to be a big issue, but I can't prove that yet. It's just a gut feeling because other viruses don't work that way. Usually influenza, the real flu, not just 20 viral illnesses during flu season. If you get the true influenza, you're not likely to get it again that same flu season. Now, you may get influenza again the next year, but as you know, there are different strains every year that mutate and so forth. So we don't really know how coronavirus is going to behave in that way, but we would expect it to behave similar to the way coronaviruses have behaved in the past. And again, just to talk about how we handled this one compared to how we handled SARS. I mean, SARS, I remember hearing about that when it came out, and it was terrifying. It was more terrifying than we thought of coronavirus at the beginning of the epidemic. Now that it's gotten so much worse, it's at least equally terrifying. But we were able to control SARS because we were able to find it and isolate it quickly, but we lost that opportunity this time. And SARS hasn't come back until now. We've got coronavirus or COVID-19.
Right. All right, great. Thank you. I have a few more questions, but before I ask those, I just want to open it up to everyone in the Zoom chat. If any of you have questions for Dr. Alcouloumre, please feel free to ask them.
I have a question. So firstly, thank you for taking the time and being here. I can speak for all of us. We really appreciate it. And it's more of a personal question, but I do have a summer internship that's supposed to be in New York in June. They have reached out and they said they still want to keep it in person. They might push back the start date, but do you just see it as realistic or not really?
It's really hard to say. And I think a lot of it's going to depend on what President Trump comes up with in May, because again, he's under this pressure to do something to start opening the economy. It very well that there are some pockets where they can guarantee testing and safety and maybe programs like this where it's going to pretty much involve healthy people who may not be exposing themselves to vulnerable people, and they can test you for antibodies. Maybe that kind of thing will happen, so there will be pockets of groups that can safely start doing something. I mean, that has to happen. I mean, the country can't go on like this. So it's really going to be the responsibility of the president to figure out how to balance what he needs to hear from his healthcare advisors with his economic advisors. My fear from what I've been seeing is he's leaning towards what his economic advisors are saying. On the other hand, he has done some of the right things. I just think he did a lot of them very late, and then he makes us very nervous when he just doesn't, and it's really not clear that he understands what he's talking about. He should, I think, let the health people give the medical information and advice and expertise. When he does these press conferences, I think a lot of people in his own party feel the same way, from what I've read. So it's not been a smooth ride at that end. I mean, I hope that they can come up with something that would allow you to go ahead with your lives and do your internships, and not have to continue to postpone it. But we're going to have some degree of social distancing. Our lives are not going to be what they were for quite a while. And I mean, at least 6 months, maybe longer. And then in the future, things will be different. But there'll be experts who are going to be giving us some advice along the way. But a lot's going to happen in the next, 3 to 6 weeks in terms of the rules about social distancing. And I think Trump's going to get some of his way. I think some things hope that they're very, very careful, and that the public health people have a huge role in saying what kind of boundaries to put around that.
Yeah, it makes sense. Thank you. I appreciate that.
Sure.
Right. Anyone else with questions? No. Okay. Well, this next question is from Lucy Santora, another one of our members. She asks, how long can you be asymptomatic and carrying the active virus? So being contagious without showing symptoms.
That's another good question, and another one they're still trying to figure out. The infection prevention people that I know and work with at my hospital have been pretty emphatic from the beginning, and continue to be emphatic, that asymptomatic people are not likely to be a huge source of passing on the infection. And I'll explain why. In fact, he actually gave us a specific number. He said maybe up to 6.5% of cases, based on actual studies that have looked at how the disease is transmitted. And that's because the coronavirus is considered primarily a droplet disease. So it's, just to say very simply, you cough, you sneeze, you generate drops of stuff. You've all seen it. And either somebody breathes it in, or it lands on a surface, and despite what you times of survival on surfaces, usually within a few minutes you touch that surface. Now, touching the surface and putting coronavirus on your hand doesn't make you sick, but touching the surface, getting on your hand and doing this or this or this, or I won't pick my nose, but introducing it into your body through the respiratory tract or the membranes around the eye are how it gets into your body and how you get sick. So the best strategies, despite all the complicated science you've been reading about, and all of the big words and all of the drugs and ventilators and intervention, the most effective thing for dealing with this, 2 things: social distancing and washing your hands. And that's really the best way to keep this disease from spreading. And again, the experts that I am getting most of my information and trust a lot, they actually say coronavirus is kind of, they call it like a weakling virus. It's not real hardy. It's not real tough. Soap and water, for 20 seconds is enough to kill it. Hand sanitizer, if you can find it, is enough to kill it. A lot of people got freaked out when they read in the paper, for instance, that the cruise ship, the Diamond Princess, where all those people got sick early on in the pandemic, that somebody went back 17 days later and found the coronavirus was still on the ship, even though all the people had left. So that was terrifying to everybody. But if you actually read the article, what it said was that RNA, which is the genetic material of the virus, traces of it were found on the ship. So it's kind of like a fingerprint. It's not an active virus. So you can get the RNA on you, it's not going to do anything. It's the virus that causes the disease. It's kind of like saying that if the murderer left a fingerprint behind, that fingerprint is going to kill you. It can live circumstances for a number of hours on different surfaces, but there's no evidence that it stays active and infective. So again, our experts say, as long as you're washing your hands, you're not going to pick it up from surfaces. If you do stupid things, yeah, you're much more likely to get it, but you don't have to be overly super paranoid to avoid it. You just have to be careful.
Thank you. This next question comes from Charlie Convery, and he was wondering, how worried should I be about delivery food and groceries?
That's a favorite subject of mine, which I got to tackle in my Facebook posts. There's a guy, he's a family physician in Michigan, Grand Rapids, I think, and his name is Dr. Jeffrey Van Wingen. And early on in doing my post, I was just looking for some information, and I came across his YouTube video, which at that time when I first looked at it probably had 15 or 16 million visits. This is in like mid-March, within a couple of days of him putting it on. I got excited when a few hundred people were looking at what I was writing. This guy was in the almost 20 million. Now he's well over 25 million people. He's quoted in newspapers. And I start watching this guy's video, and he's explaining, he's got a ponytail, and he's wearing his gray scrubs in his kitchen, and he is trying to explain to you. He says, I may seem a little stressed right now because we're all worried about coronavirus. And he is very stressed. And he talks about applying what physicians call sterile technique, which is how we keep from, usually in an operating room or an emergency room, where you're wearing gloves and you're trying to take care of something. You're suturing a laceration, you're doing surgery. You do it in a sterile manner, so you're not introducing bacteria into the person you're trying to treat. So he wants to take these techniques of sterile technique and apply them to managing your groceries. So he starts by explaining that when you go to the store and you get your groceries and you bring them home, you leave them outside for 3 days because coronavirus can live on surfaces for 3 days. It's been proven. And he goes off on that tangent. Well, of course, you can imagine if you're leaving your meat outside in your garage or front porch for 3 days, you're not going to be able to eat it in 3 days. And there's all this crazy stuff where he takes every item of food and he scrubs it down with like Lysol wipes. He actually was washing his fruits and vegetables in soapy water until a couple of days later, he finally had to update his thing because he said, well, I talked to some people who were food scientists who said, you really can't do that because the soap in the soapy water might make you sick if you eat it. Well, duh. And he just does this crazy stuff. And people got really affected by this and more paranoid and started doing what he said. So I kind of just talked about how silly that was. There's really no science behind what he's talking about. It's very impractical. A lot of the stuff he did was really dangerous, like, again, putting chemicals on your food to disinfect it or leaving things outside where they might spoil. And I had people just thanking me on Facebook for saying, oh, one of the things was frozen pizza. He made a big deal about coronavirus thrives in the cold, and it lives on cardboard. So if you put your cardboard box with your frozen pizza in the freezer, you're going to get coronavirus. And this poor woman had given her husband frozen pizza before she saw the video, and he got a little sick from it. And she was sure she had killed him with coronavirus. Another person had gone to Costco and bought hundreds of dollars of groceries and brought them home, and put everything away. And then sat down and then saw the video. And she and her husband were thinking, we have to go through the whole house now and throw everything away we just bought, scrub it all down and sanitize it. Excuse me. It's my little allergic cough. It's not coronavirus. I've been tested. But it's crazy. You don't have to do all of that. And I've seen other people too. Even Sanjay Gupta on CNN was talking about Dr. Van Wingen, who I call Dr. Van Wingnut, because he's just absolutely paranoid. And I found a lot of credible people who have posted articles about what he's doing is just wrong. If you are careful not to touch things and touch your face, to wash your hands, after you handle things, before you put them away, you're not going to give yourself coronavirus. It doesn't live on the packages and surfaces that long that if you put something on in your pantry and take it out 3 days later, there's no live coronavirus. It's not possible. We're not doing anything special or extraordinary in terms of that kind of stuff to reduce our risk. It's just not realistic, and it's not a mode of transmission. There's nothing anywhere in medical literature, that says you can catch coronavirus either from food. It is not a foodborne illness. None of the coronaviruses are. It's droplets. And it's not, although it can survive on packages, it's not thought to be a way that it's actually transmitting live disease. That makes sense?
Yes, great. Thank you so much. All right, this next question is also from Lucy Santora, and this pronunciation is going to be a little sketchy, but regarding hydroxychloroquine or Plaquil, have they found any definitive information on this? Her mom uses medication for her lupus, and it's in major shortage right now.
Hydroxychloroquine and Plaquenil, which come from they use now for rheumatoid arthritis and lupus. And a lot of people are very dependent on that drug. And like Lucy's mom's experience, because a bunch of people want to start hoarding it when President Trump started talking about it as the miracle cure, it's called game changer. People started buying stocks of it. There are doctors who I think are part of this thing who are also buying it up, and they're working on the front lines, and they're taking it because they think they need it to protect themselves. A lot of this comes from a study that was done in France by one guy, a properly done scientific study. And although it did get published, I can't remember the names of all the groups there, it was in France, but the Society of Specialists for that particular journal that it was published in subsequently just ripped the study apart and said that it didn't meet the standards of what an appropriate scientific study should be, and evidence therefore could not be used to prove it works. If you listen to President Trump, if you listen to his I think it's his trade advisor, I think is the title, Peter Navarro. If you listen to the head of a conservative, what do they call it, like a political action committee that raises money for Republican causes. He's a billionaire president of, I think, Home Depot. A lot of these people are pushing very, very hard to have hydroxychloroquine out there. And President Trump, of course, with his podium, has really kind of thrown a lot of fire on this kindling. But if you listen to Dr. Fauci, who's his healthcare expert, standing next to him, he continues to say there is no scientific evidence that it works. There is some anecdotal evidence that it works, like the study in France and a couple of others. There are people who say, yeah, I gave it to all my patients and they're all better. We even have a guy in Laguna Beach here who has a local medical clinic. And I saw something he had posted on nextdoor.com or somewhere about this very comprehensive treatment of coronavirus regimen that he has. So you go there, you get tested, you have it, and he gives you hydroxychloroquine, and he gives that along with the Z-Pak. And then he has you drink quinine, 20 things. And I think he's supposed to be a credible guy. I've seen his name before. But if you think about it, I mean, most people with coronavirus don't get that sick. So if you take a bunch of people who aren't sick and you give them some medicine and most of them get better, that doesn't prove that the medicine made them better. Most of them would have gotten better anyway. The problem with hydroxychloroquine, and especially if you give it with azithromycin, is it has an effect on the heart in some people where it can cause fatal as in you die from it, changes in heart rhythm. And so you got the situation where you've got this drug where a lot of people, for whatever reason, maybe they really believe it. I'm not going to say this, so you didn't hear it from me, but I have read things from reasonably credible sources that a lot of the people pushing it have a financial interest in the company that makes it, Novartis, which may be why they're hoarding and stockpiling it, and President Trump's going to make sure it gets on them and sold in mass quantities. But you have all of these people taking it, and many of whom may die from the side effects. Many of them will get better because they're going to get better anyway, and you have no way of knowing if those who got better, because you're not studying it properly, needed to take it in the first place. So it is being studied now. We should have some data. It's probably going to take weeks to months to really know, but I'm not recommending it or pushing it. I wouldn't take it myself unless I were part of a study and it was being watched very carefully. So it is a big deal, and it's a political deal. It's a real political deal, because you'll see a lot of these kind of crazy things, and they're mostly on the right wing, that are just questioning why people like me refuse to prescribe it when it is valuable. Again, there's no scientific evidence for it, and they view your refusal to give it as a reflection of, you must hate Donald Trump. You're doing this because you don't like the president. The Democratic Party is so anti-Trump that they're going to withhold this life-saving drug from the rest of us. You hear that kind of nonsense, but it's nonsense. I'm not saying that it's not going to be proven to be effective. I'm saying we don't know because nobody's done an adequate test. So don't get sucked into that argument, because I'm not pushing it and I'm not against it. I'm saying test it. Let's find out. If it works, I will prescribe it right and left. If it doesn't work, I'm not going to prescribe it. Let's find out first.
That's great. All right. And so my last question, before I open it one more time to the members, if anybody else has any questions, is how important is that vaccine, like a vaccine, to the timeline, and what will come sooner, a vaccine or a cure?
Damn, you guys are smart. Those are good questions. And again, the real answer is we don't know yet. Vaccine, I know we were told, by the president early on, we were told we could test everybody. The tests are available. They weren't then. They're still not now. But we were told that a vaccine would be ready in a few months. It takes a year to a year and a half minimum, even with the best minds working on it, before it can be developed, tested, proven, and then produced. So a vaccine isn't going to help us today. It's going to be important in the long run, but in the near term, it's not going to be a factor. A cure. So maybe about 2 weeks ago, as I was kind of reading a bunch of stuff on this, something just really, really struck me, because I've been putting most of my efforts on, again, trying to persuade people to support the whole idea of social distancing and washing their kind of stuff that you can do. Stuck at home, you think, you're wasting your time sitting there. You're actually really doing something important. And from those curves that I showed you, and from how my, shifts with not enough work for me to do when I go to the hospital right now are, you have done me a tremendous service by doing, because we were able to control the spread in our community. So as I said at the beginning, we're not going through, and not likely to go through, what Italy went through, what New York is going through, what New Jersey is going through, what New Orleans is going through, what Detroit, and probably soon to come Washington, D.C., and Philadelphia, Chicago. We're not going through that because we got on this and we didn't spread the disease. So I was really focused on that. And then in the emergency room, when I see these people first come in, they're sick, and we put them in the hospital and they get sick, but then they get sicker. So I'm not the one who takes care of them at their sickest unless they arrive that way. And then I have to put them on the ventilator. Most of that's done in our intensive care units by our intensive care specialists. And they're the ones who day after day have to be taking care of these people as they watch them circle the drain. You've probably heard stuff about the ventilators don't seem to be working. Some people say the ventilators may be dangerous. Ventilators are kind of like a last-ditch thing. We use them all the time to help people when they can't breathe, or they got horrible, bad pneumonia, or heart failure, or for other reasons, or during surgery, they're on ventilators because they can't breathe on their own. It's a life-saving piece of equipment. But what we're finding is that once somebody gets on the ventilator with the bad version of the COVID, is they usually don't come off. In New York, 80% of people on ventilators die. And it's been very frustrating for the physicians taking care of them because they don't understand why. I see a patient that comes in with certain symptoms like a fever and they can't breathe. And I know what we do. We put in an IV, we give them IV fluids, we put a tube in and put them on the ventilator, and they usually will get better. These patients don't. And what we are learning is that the bad version of the disease isn't like just a regular virus pneumonia like you might get from the flu. It involves all of these crazy biochemical things going on, which some of which impair the ability of the red blood cells and the hemoglobin to carry oxygen to the lungs. Also, blood clots seem to form everywhere, little tiny blood clots that plug up all of the blood vessels in the lungs. So there's a lot about this we don't know, and we're investigating about different things to do to try and fix those biochemical things that are affected by this virus that are unique to this virus that we don't see in the typical really sick people that are on ventilators. So will there be a cure? Yeah, I think there will. I think we'll figure out what it is exactly that this virus is doing to cause these really weird things that we don't see in similar diseases. Hopefully that will come soon because, again, once you get on the ventilator, your odds aren't good. Not everybody dies, but a lot of them do. And we're trying new things, and we're learning new things. My hospital is involved in some of the drug trials. So we have a lot of people who are connected nationally with people, and internationally, in fact, with people who are doing research. So I'm very hopeful that we'll have a cure. So I hope we have a cure before we have the vaccine. And then I'm hoping we have widespread testing so that we can do more to reduce the spread and minimize the number of people who actually need that cure.
Right. Great. Thank you so much. So I just want to, again, check if anybody else has any questions.
Yeah, I have a question. Once again, thank you for being here. This has been really helpful to listen to. So like you just said that, like, internationally, I think that we will find a cure. And I'm curious as to like what you think the relationship between like different countries will be and like disseminating that cure out. And if you think that like it will become kind of like a power play of like whoever finds the cure.
That's another good question. You guys are smart. I like this. And obviously, being in international relations, that is something you guys probably would think about. So what I have seen a lot of in the news and things I've read is an unprecedented amount of cooperation between scientists in different countries, where they're all working together. They are, sort of open sourcing things they're working on so people can work together and collaborate. And there is a lot of that going on. What we're seeing, though, at the same time is you see it in this country with states trying to get supplies and ventilators and masks and protective equipment. You see them bidding against each other. I mean, a few months ago, there was something about the president had tried to, I don't know if this was true or not. I honestly didn't research it, but I read it a few times. Something going, trying to buy the exclusive rights from some German company that was working on a vaccine. So it would be America would get all of it and nobody else would. That's not the norm. I think the norm in the scientific community, from what I've read, is just one of unprecedented cooperation. Nobody wants to get there first so they can say, yeah, we France, we got it first, and we're going to help the French people first. It's let's find this and fix it together. So that's very encouraging.
Right, great.
Did that answer the question? Was there more there?
No, yeah, that was great. Thank you.
Thank you.
Great. Any more questions for anyone? No? All right. Oh,
Bennett in the corner there.
Hi, I have a question. How does the hospital interact with the state in a situation where, like California, where, things are going pretty well over relative versus New York, where things are hitting the fan?
Interestingly, because we're not faced with the crisis they have in New York, we don't necessarily have to cooperate with each other on an emergency basis yet. There is cooperation. I mean, at the state level, there's a sense of who has the resources. We know that if a hospital near us needs ventilators, we have 50 extra ventilators that we don't anticipate needing. There's enough given the system, we can do that. I know California has sent, I think, at least 500 ventilators, or maybe it's 5,000 ventilators to New York. And I know that Governor Cuomo, and if you haven't watched any of Governor Cuomo's, and Cuomo in New York, if you haven't watched any of his press conferences, they are the most informative, enlightening things you'll ever hear about coronavirus. And I try to watch them almost every day. After work, I can't, but he goes through, he has a PowerPoint, he goes through every day the statistics, what they're doing. He has just a beautiful, very sensitive, humanitarian, emotional tone in this presentation, very empathetic. So he's hurting. His own brother, who's a newscaster or an anchor for CNN, got coronavirus, and it makes it very personal for him as well. And he talks about what it's like to work with the federal government and the president, because there's a lot of stuff going on there about, who do the federal stockpiles belong to? Does it belong to the federal government, or does it belong to the American people who live in all of the different states? A lot of craziness coming out of Jared Kushner last week about that. But one of the things Governor Cuomo has done is they have set up an incredible amount of cooperation between hospitals. So normally these hospitals in good times would be competing with each other for patients. We're the best hospital. No, they're just all trying to struggle and survive. And you saw from that graph I showed you that they're just overwhelmed. They don't have enough beds, ICU beds, or ventilators. So they have to work together. So they are. And some of the hospitals, one of the worst hit is the hospital in Brooklyn, the University Hospital there, which I mentioned earlier, where they're just, gurneys are just piled next to each other with all these sick people. That hospital is only seeing COVID patients. So patients who would normally go to the Brooklyn Hospital with non-COVID issues are being sent somewhere else. So there's some cooperation working together at a higher level, and the state seems to be the allocate those resources and kind of spread the responsibility and the resources together.
great. Thank you so much. Well, if there's no more questions, I just want to thank you again, Dr. Alcouloumre, for joining us. I think I speak for everyone in that this talk was extremely informative and helpful to our understanding of this pandemic. It's definitely good to hear that there's some silver lining in all of this.
Yeah, I think we're going to get through this. I mean, we will have our lives back. It's going to be a bit of a struggle. And I feel terrible for you guys because of the stage of your life you're at. But this is something you're going to remember in a few years, that you remember you went through together, just like people who went through World War II, or my generation that came into the tail end of Vietnam. And it's something that it'll be a story you'll tell your children and your grandchildren about all the sacrifices you ended up making. But I have no reason to believe that we're not going to get through this, and we will be as good as we ever were, and we will have learned a lot. So if we ever have to face this again, we won't wait 2 or 3 or 4 months to where we have to do this, and we will be able to nip it in the bud at the very beginning.
Great. Thank you so much.
Well, thank you, guys. Honor and a pleasure to spend this time with you. So thank you.
Thank you.
Thank you.
Thank you. Really
so much.
appreciate it.
Thank you, guys.
Thank you.
Have a great night. Thank you. Bye.
Thank you.
Thanks. Bye.
Hi, Dad.
Hi, Princess. I love you.
Love
Thank
you.
you so much again. Thank you, Kira, for doing all this. You're the best.
Thanks for sending
it up. That was great.
Oh God. Yeah. Thank you. I'm
See you
just
later.
recording. Okay. This can't go into the